The skull, well, let's just say the skull is pretty intricate. It's got a lot of bones in it. It's got a lot of neat features, and for good reason too. It's got a lot of nerves coming out of it that innervate very different places. You got a lot of interaction and movement going on, so there's going to be a lot of markings and there's going to be a lot of plates. So we got 22 bones, not including the 3 middle ear bones that help with hearing, each of which again has all those different processes. What we're going to do is we are going to name a lot of these bones, and you're going to want to be able to name the bones that take place in the varying cavities. Like the eye socket, you want to know all the bones that are there. In the nose cavity, you want to know what the bones are there. In your mouth, you want to know what bones are in there. Cranial cavity, you better know what's going on inside that cranial cavity, what's caressing your thinky parts. Let's begin with the front of the face. You'll see that a lot of these terms that are in not in bold, you don't really need to care about that right now. What you do need to care about is the ones in bold. We're looking at the bones. So if you slap your forehead, you are slapping your frontal bone. You are slapping your frontal bone. This is protecting, surprisingly, the front of your brain, which is also the lobe right underneath that frontal bone is called the frontal lobe. Yay! So if you remember these positions of these bones, it's going to really help you out later on when we're talking in A&P2 as well as in A&P3, so just get familiar with these names and terms. If we were to go ahead and continue our discussion into the eye socket like I suggested, I'm going to go ahead and switch over to this skull right here so it's a little bit cleaner. You'll see this green bone back here, the most posterior portion of your eye socket. The orbit is the sphenoid bone. You're going to see that sphenoid bone in different locations. You're going to see it in your nose. You're going to see it at the bottom of your skull. You're going to see it inside your skull. That sphenoid is spanning almost every single cavity. It's a really neat bone. We're going to talk about it a little bit more, but for now, sphenoid bone, you can see it's part of the eye socket. It's that nice green color. It's obviously not green in real life, but in this diagram it is. So you got frontal, sphenoid. Let's migrate laterally. Let's migrate laterally over here. If you were to pinch the front of your face just a tiny bit off to grab the more lateral portions of your eye socket and then grab your cheeks, you would be grabbing this bone right here, the zygoma, the zygomatic bone. And the zygomatic bone, again, it does play a role in your cheekbones, but it also plays a part of your eye socket or your orbit. If we go back to the sphenoid and scroll back over more immediately, we'll have this bone right here. That is your ethmoid bone. A lot of neat things going on there. It is, you're going to see it in the nasal cavity. You're going to see it a tiny bit when you're looking at the skull from below. You're also going to see it for inside the cranial cavity. This bone, what's really neat about it, it does have the neurons, the nerves that sense smell coming through it. And we'll talk about that in a little while when we get a better picture of it. So you got your ethmoid bone. You scroll down just a tiny bit, you get this itty bitty tiny teeny tiny dot. That's called your palatine bone. You might not be able to palate it, but that palatine bone, it does span a similar fashion as that of the ethmoid and the sphenoid. Let's go ahead and take a look-see at the bottom of your skull. Here's the bottom of the skull. That dark blue color right here, there's your palatine bone. It's part of your palate. It's part of your hard palate. That's why it's called the palatine bone. So that palatine bone on the very back of your hard palate also spans all the way up into your eye socket. Next up, if we were to go more medially from your ethmoid bone, this orange color right here, and see that slight purple, that is your lacrimal bone. What's neat about the lacrimal bone is that your eye gland's over here, your tear gland's over here, it swipes and wets your eyeball, keeps it moist, But that liquid eventually ends up into your lacrimal bone through a lacrimal duct, which drains those tears into your nasal cavity, which 99% of the time what happens to that liquid is, well, you swallow it. Finally, the last bone of your eye socket is this one right here. It is your maxilla. The maxilla is the upper jaw. All your upper teeth are inserted into and connected to this maxilla. The maxilla also holds together the bottom of your nasal cavity and looks like it holds up the part of your orbital. We are almost done with the front of the skull. One last one obviously would be this one. This is your mandible, the lower portion, the one that I'm moving up and down often and frequently, that you are opening it and closing possibly by yawning. So let's go ahead and take a side view. What's so special about this side view is it also helps you label the lobes of the brain. Again, there's that frontal bone. Guess what's underneath that? It's the frontal lobe. And what is this bone? Well, it's the parietal bone. Guess what lobe is mostly underneath this parietal bone? Well, you probably guessed it, your parietal lobe. You got right here your occipital bone. Take a guess what's underneath that. Well, your occipital lobe. This is your temporal bone, this purple one. And there's a couple of neat things about this one. Obviously, the temporal bone also hides and encases the temporal lobe of the brain, but there's also a couple of other things about it. You'll see that meatus that I was talking about, the external auditory meatus, you can see the opening to it right there through the temporal bone, which suggests that a lot to do with hearing is done with this bone or through this bone. You'll also notice this styloid process, this little long probe, purple probe at the base of the skull. Helps in part with how far and limiting how far you can open your jaw, among other things, but for now that's all you need to know. Finally, you'll see that there is an extension of that temporal bone to your zygomatic bone, and you can feel, it's a little bit, you'd be surprised how hard it is to feel that bone or that arch. You think it would be rather easy. But what's going on there is a lot of your chewing muscles, a lot of your speaking muscles and all that stuff are passing underneath that zygomatic arch and feeding up and then connecting to your skull here. So that zygomatic arch allows for that passage, and all those strong muscles or that gap that you don't really feel, maybe it's just me because I talk too much that I don't really feel it much. But you don't really feel it, but you can feel like the ridges of it. Let's go inside. So we've cut open the skull and we're seeing the different colors. They've left it in the different colors, which I appreciate very much. And we're looking at the inside of the cranial cavity. Again, there's that parietal. Let's start off on the front again. You got that front bone, that frontal bone. And guess what's underneath it? The frontal lobe. Guess what's underneath the parietal lobe. Guess what's underneath the occipital lobe. And guess what's underneath this here temporal bone? The temporal lobe. And I did mention again how that sphenoid bone really expands or goes through the entirety of your skull. It's almost in every cavity. There's the orbital cavity here, just underneath that. You also have the cranial cavity. Look, it's down inside the smelly cavity, the nasal cavity, as well as it kind of leaks into that your oral cavity. It does span it, and you can notice that it is quite fragile. Look how thin that bone is in comparison to your occipital, your parietal, and your frontal. What's going on here is that these things have cavities. There's several of them that have cavities. The appropriate term for it is a sinus. Your frontal bone has a sinus. Your sphenoid bone has a sinus. Your ethmoid bone actually has sinus. It's not really well shown here. And your maxilla has some sinuses in it as well. We'll talk about that in a different picture here in a little while. But let's go ahead and take a look-see at the inside into the cranial cavity. There's that sphenoid. There you got the greater wing here of the sphenoid. It looks like a wing, like maybe a butterfly wing. It kind of, now I'm looking at it right here, it kind of looks like the beginning of an elephant with its giant ears. But it's nice big insect wing almost. In the middle of it is the sella turcica. I call it the saddle, because literally their brain is sitting right here, and there's something called the pituitary gland, which produces all those different hormones sitting inside that sella turcica. That sella turcica is a really, really important landmark. A lot of things are going on right here. Not only your pituitary gland, but your optic nerves, the things that receive and interpret information and tell you what you're seeing, pass through right here where the cowboy would stick their hands in maybe. You got the hypothalamus just above this. It's a very sensitive and important thing to be protecting that area. So I have highlighted all the important stuff. I'm going to go ahead and talk about this because we are in video, but as of right now, you don't really need to know them, so fast forward through it, but I'm going to talk about it because it's a good little metaphor to help you remember all these different things. But for now, I do need to point out this last one before I move on. There's your ethmoid bone. Remember how I said that the nerves for smelling passes through the ethmoid bone? This is it right here. It's actually called, the thing that it's called is called the cribriform plate. And inside that cribriform plate are a bunch of holes, olfactory foramina. I keep on stumbling over myself. But little bits and pieces of that nerve sneak down into that nasal cavity, have their nerve endings in that nasal cavity so it can smell those odors, aka odorants. With that, let's go ahead and talk about the sella turcica and my little metaphor to remember the holes, the foramens, all around it. So pretend you're a cowboy. You're going to be sitting yourself down in here in this sella turcica. So the sella turcica is your saddle. You're there on your horse, and you're going to stick your boots into the rotundum. You sat down. You put your hands into the optic foramen here, and you're sticking your boots into here, into the round portion, the stirrup, which has a little round opening for you. So you put your foot in the rotundum, and since you have these ugly little spurs on them, you're lacerating the poor thing that you're on. So you have the lacerum going on right here. So the foramen lacerum, your feet are wiggly, and your spurs are lacerating. What happens now is you are looking around as a cowboy, using your orbitals. You are looking down in the fissures of your great canyon that you're looking at. And now you are looking over the valley. Oh, valley. You're looking over the valley. So you're sitting on the cowboy hat. You're put your boots here, and you're now looking over your valley. Oh, valley's there. And you're noticing in that valley that it's very pointy and spiny with the cactuses. It's got a lot of spines, the foramen spinosum. So foramen ovale, foramen spinosum are right there in between your rotundum and lacerum as you look off to your side. With that, those are your foramen that are important, that are portions of your sphenoid bone. A lot of those serve as cranial nerve openings. So there are nerves coming off your brain going direct, rather than going down your spinal cord, but actually just coming out of your skull there and doing their job there. A lot of them go through these different foramens. We don't need to discuss them right now. You're in A&P1, not in A&P2. So we talked about the sphenoid bone. Let's talk ethmoid bone. You'll notice that again, it has a good portion. It has that portion in that cranial cavity. It has that foramen, olfactory foramen going on right here, so that way your nerves can sneak into your nasal cavity and actually receive and interpret odorant molecules. You'll also notice from the side that the front, let's go back to the front picture really quick, that it has like a little swirl thing. Those are concha, they're called, but you'll talk about that in A&P4. But it's just a way to help warm and moisten up the air by making it swirl inside your skull rather than before going down into your lungs. You'll also notice that it is rather quite holy. That's because it has sinuses as well. And because we're in the nasal cavity, it'd be really, really wise of us to talk about the bones that would have sinuses in them. So we're transitioning from the ethmoid bone, which has sinuses. And we also know that through the cribriform plate, it allows the nerves to enter into that area and smell. But we're also going to talk about places that warm up the air. So you got your sinuses, you got some sinuses up in your frontal bone. So when you get a sinus headache and you're rubbing the top of your head, you're actually rubbing those frontal bone sinuses. You got ethmoid bone sinuses. You also have that really large maxilla or maxillary sinuses. And as well as, don't forget, the sphenoid bone is nice and weak because it has a bunch of those sinuses as well. So you have 4 bones with sinuses: maxilla, ethmoid, frontal, sphenoid. Do not forget also that you have, there's your ethmoid, you got the palatine over here, the maxilla makes up a portion of that, but you also have the vomer that acts as a septum. That's separating the 2 nasal cavities from one from another. Let's visit just very briefly on the mandible now. You'll see that it has a condylar process. Remember that fossa that we talked about earlier that has that little indentation? Well, that indentation receives this condylar process with a notch dug into that and a coronoid process on the other end of that to sort of help keep your jaw closed in an appropriate way. Ramus is a really fancy way of saying arm. Those of you that speak some type of Latin-based language, Spanish is what I'm thinking of, but rama means branch or arm, depending on if you're talking about a business or something. But a ramus is like an arm. So you're talking about a branch or an arm here of this mandible. You got the angle as well as the mental foramen and the mental process. Why it's called mental, I don't know. But all I can think of is that the mental is, you scratch your chin going when you're mentally engaged. One last thing, come on, I know there's a good picture of it. There's the sinuses again. You can see that that green sinus is that sphenoid. The red one's your ethmoid, blue one is your frontal, maxilla is this yellow one is your maxilla. They do come back into that nasal cavity to help warm. So the air goes in, but when you goes in here and swirls around and moistens up and warms up to help get it to your lungs in a nice warm fashion. You're also going to notice though that you have a nasal lacrimal duct. Remember how I said that you had your tears are constantly being produced to clean up your eye, but at the other end there's that lacrimal duct in your lacrimal bone. Well, it feeds into your nose and you swallow it most of the time. This also explains why if you're having a crying fit or you're having a really tough time, you're actually producing, and you start getting a really runny nose. That's mostly because your overproduction of your liquids coming into your nasal cavity and dripping out. You'll also notice that you do have an opening to your middle ear, your auditory duct. That's just to help release liquids as well as balance out pressures. We'll talk about that in AMP2 a little bit better. With that, let's finish up our discussion on the skull about the development of the skull. So those sutures don't start off as sutures. They start off at fontanelles, that the more of a fibrous connective tissue going on here. It also explains why you have those soft spots going on children. You don't want the skull fully formed as a child. It would, if it did, you'd impede development. You would also have a very tough time in the birthing process, because if you've seen a child born naturally, you'd see that the baby comes out as a cone head. Cone head is only a bit allowable because of this fontanelle going on. Let's lump the hyoid bone with this, and then we're going to go ahead and let the vertebral column be all on its own. But the hyoid bone is one of those bones that just you think that most bones are somehow connected to another bone. The hip bone's connected to the arm bone. I don't know how that's possible. I don't know my song very much no more. But the hyoid bone is one of those bones that is just free floating. It's not really connected to any skeleton. It's just there, or some type of other bone. What it is connected to is all your swallowing muscles. So that hyoid bone allows for the connection and attachment of those muscles so that you can appropriately swallow. You can feel that hyoid bone by tilting your head up about a 90-degree angle and then feeling your neck up in that where you had turned it at a 90 degrees when you're looking forward. With that, hope everything goes well, and we will see you soon.